stars were all aligned that day, as I was told later, that he happened to be on call at that moment, because it could have been a lot worse. We have a friend who's an orthopedic, and we give him a lot of business, unfortunately. So my husband actually texted him from the emergency room. This Dr. Tarantino was actually on the soccer field with his son, Jack, and my husband said, "Broken arm, Chris, Dr. Deitch, what do you think?" We would not have moved forward without his blessing, and he said, "Absolutely great, trained with him, go ahead." And Dr. Deitch just jumped right in and made us feel comfortable with the plan of action, made Chris comfortable with what was going to happen and the timeline. We knew exactly what to expect. So
yeah, so he had to go to the operating room.
They made us very comfortable. Chris and I stayed the night. Lots of round-the-clock service. The nurses were fabulous.
Saturday evening in the emergency department can be a difficult place, but we do have great pediatric emergency department specialists, and our nurses are fabulous there. And I give them a lot of credit because they never know what's coming around the corner, and yet somehow they manage to give everybody the kind of care that we would want for our own loved one, which is what we're striving to do. And on a bad moment, it's hard for them to do that because of the unpredictability of their business.
Well, I'll tell you, Megan Silberzahn was our first nurse, and she made all the difference. We walked in, and I found out later that it was her first day flying solo. And so she, you know, was not knowing what to expect any more than we were. And we came around the corner, and they put us right in the room, and she came in and did a very quick assessment and realized that this was going to be a little bit beyond her scope. Immediately brought in Amanda, I believe, and Amanda sat down closer than you and I are and said to Chris, looked him in the eyes, "This is exactly what you can expect to happen. This is how it's going to work. It's, you know, we're going to try and make you as comfortable as possible. We've already given you some morphine. We're going to give you some more. You know, we're going to do this as quickly and as painlessly as we can, but you'll feel it. But it's going to happen, and we'll get through it."
So then after the first surgery, Chris went home and did okay, and then he had to come back?
That's correct. That's correct. He had to come back and get 2 rods taken out of his bones. So
and that went okay?
That was wonderful. It was a non-event compared to everything else. Yes.
Great, great. So we've chatted a little bit. We're so grateful that you've told us about your story, and I think we have fabulous people in the emergency department, and clearly Dr. Deitch is an expert hand and wrist surgeon. Is there anything that, looking back, you thought we could have done better?
The only thing I would say is that when we were checking in the emergency department right at the front doors, my son, who we didn't know to the extent of his injury at that point, but had broken both of his bones and I'm sure was in excruciating pain, was basically made to stand while we were checking him in, and we had to ask for a wheelchair just to put him down as his face went ghastly white. But as soon as that happened, he was taken right back. So just a little bit more attention to the condition of the patient would have been helpful.
Sort of at the front end.
Exactly.
Before, probably even before triage, right?
Right, right.
Yeah.
You know, when we're giving the driver's license and insurance card, that type of thing. Just to, do you need to sit down? There were no benches or anything there for him to sit on, really. We had to ask for a wheelchair to be brought over.
Okay, great.
So that would be helpful.
Well, thank you very much for your input. Is there any closing words that you have? Or?
I would just like to tell all the nurses in the ER and the pediatric department, thank you.
Well, that's wonderful. Well, thank you very much for your trust in us, and we will make sure that we let the ED docs and nurses know what a great job they do.
Thank you.
Thank you very much.